This episode of the Social Workers Rise podcast is partially brought to you by the 11th Annual Addictions Conference, Inclusive Recovery, Addressing Diversity and Co-Occurring Disorders. Check out the link in the show notes for more information. Hello, and welcome to another episode of Social Workers Rise. It is your host, Catherine here. We are on episode 183, and today we're going to be talking about medical social work. What is it? What are the different options? And how the heck do we get started if we don't have any experience? So, my background is primarily in medical social work, and I am a huge fan of it. My favorite part is just seeing the intersection of medical needs and mental health needs and helping people navigate through this massive system that is sometimes dysfunctional and unfair. So, a little bit about me. I started this podcast back in 2020. Oh my gosh, feels so long ago. Back in 2020 from a place of burnout, to be honest, because I felt so done. I'm like, this is not the life that I signed up for. I did not get my master's to be this miserable. What is going on? I was so burnt out and miserable. And I thought, you know what? We need to change this because the social workers I know are amazing. And this culture of burnout does not need to be the standard. We need to start changing this narrative. And that's exactly what I started to do. I got a microphone. Well, honestly, I got an app on my phone and used my phone's microphone to start recording and start talking to people and start interviewing other social workers. And since then, we have grown to be the #1 social work podcast in the world. And I'm really, really thankful that you are here. And by the way, that stat is from the summer of 2024. So if we are no longer #1, do not come for me. I swear, I have proof. Okay, we made it. But I'm so happy that you're here because I hope that this episode about medical social work can help you if you are considering going into medical social work, if maybe you have an internship, if you wanted to work in the hospital and you're like, I didn't get it because they want experience, but what the heck? How do I get experience if nobody will hire me, right? So this will give you some ideas around other places that you can start your career so that if hospitals are your jam and that's where you want to be, this episode will definitely help to give you a roadmap or at least give you some other ideas of where you can start on that journey. So I'll tell you a little bit about my background. I started in medical social work in hospice. And I loved hospice work. I still love it. I love working with the clients, with the teams, with the families. It's almost like an ending to the story. And I think it's beautiful to have that closure a lot of the times. But I've also done work in palliative care, which is the step before hospice normally. And I've worked in the hospital in various different settings in the NICU, working with new mothers, new babies. I've worked in the intensive care unit, ICU, worked in the emergency department, worked in oncology, and the general floors. So I've had a lot of different experiences in various settings and with different populations. And I've done some research too. The other good thing that I like about medical social work is the pay is typically pretty good. It's going to be right up there with government jobs as far as pay goes. So that's always a bonus because I know you have those student loans that you got to pay off. You got bills. One day, maybe buy a house, get yourself a new car. So we need some money to do that. According to my research, the average salary in the United States for medical social work is about $71,000 per year. And this is as of the summer of 2024, but a normal range is going to fall between $64,000 and $78,000 per year. Of course, there will be jobs that pay you less and there will be jobs that pay you more. But this is kind of what's normal. So if you are starting out just out of grad school, then this is, kind of where you can expect to start. And also, too, I will say that most medical social work jobs do require an MSW. And that's because there's like a lot to know. I mean, you gotta really be on your game. And a lot of the hospital jobs specifically that I've seen, I'm based in California, but still I've talked to a lot of people around the country. And you do need a license for a lot of the jobs that are going to be based in the hospitals. And from what I've seen and my own experience is you need a license because you get thrown a bunch of stuff in one day and you better know your stuff. You better know what to do because there's not time to be phoning a friend, to be tracking down your supervisor, to be like, what do I do? How do I handle this? Like, you need to know your stuff, right? So all of these different settings that you might be working in that are seemingly unrelated to hospital social work are actually very applicable. So do not discount yourself out. If you are working as a social worker, most settings, you have skills that are going to translate into the hospital. Let me explain. When I was working in the hospital, a lot of my work was per diem, and it'd be me and one other social worker covering the entire hospital. And a lot of the entry level jobs you get are per diem. So you're not going to be just focused on one section and know just one set of resources, right? For example, if you're working with new moms, there's like a set of resources, right? You got to know child abuse, CPS, drugs, breastfeeding, there's just like one set of resources. However, when you start off per diem, you're going to be working with everybody, for better or worse. And there would be days where I would go see a new mom. I would be working with CPS. I would go see someone who needs to transition to hospice, and you have to have that conversation with them. I would see a teenager who tried to commit suicide in the emergency department. I would see someone who is experiencing domestic violence and they're trying to get out of this relationship. What do we do? What are the resources? I would see another person who has alcoholism and they're in the ICU because they drank too much. And so there's all of these different facets that you need to be aware of, and you need to have experience, at least in some of them. If you have zero experience, the hospital is not the place for you because there's going to be all of these things thrown at you and it's going to be overwhelming and it's not going to be a good fit. So I know that hearing this, that you have to have your license, might be disappointing and discouraging. But also the other way around that is if you have experience. If you do have experience in a lot of these areas, then that might be your foot in the door. I will say that hospitals is the most well-known setting, but it's definitely not the only setting. There are so many other settings within the scope of medical social work that can get you started. We're going to hit pause on this conversation real quick because the next time that you need continuing education units, I highly recommend the Therapist Development Center. TDC has helped more than 100,000 social workers pass their licensing exams, including myself. I love that TDC CE courses are engaging and relevant. Amanda and her experts give us clear and practical skills that we can immediately apply to our work. Some of my favorites are their Edge of Life Suicide Prevention course, where Amanda shares her personal experiences, and their They Did What? Law and Ethics course that looks at real cases where therapists faced formal disciplinary actions. We are legally required to take continuing education to increase our competence, and most other courses out there don't actually teach the material in a way that we can learn it, but TDC does. Check out the links in the show notes. For example, I mentioned my role within hospice. So hospice is definitely a place that you can get started and is going to give you a lot of really great experience talking with patients and family about death and dying. And I know it sounds depressing, but it's not so bad when it's not your family. right? It's a stage of life and it's very meaningful work. You leave every day knowing that you made a difference because people in this area are so lost. How many times do we have people at the end of their life in our families, right? So the patients and the families, they need your support. They need your advocacy. They really need you there. A lot of times you can get these jobs with an MSW. I did my internship here. You can also get in with a bachelor's of social work because most hospices do have a bereavement department, which is going to be the people who call up the families after a loss, offer them counseling, offer them bereavement services. Sometimes they'll have bereavement support groups that you can do at a bachelor's level. And again, this might be different based on your state. This is just the data that I've seen. So hospice could be a really good place to start because it's also going to get you around the interdisciplinary team, which in the hospital, you are working with all sorts of doctors and nurses and physical therapists and respiratory therapists and chaplains. Same thing with hospice. And hospitals love to see that you can have these challenging conversations, these difficult conversations with patients and families. The other thing that I love about hospice is that you go to where the patient is. So it might be in their home, it might be in a nursing facility. It's very much field based. So you can get a really great idea of what this client or patient is living with and how to help them. And it helps to facilitate conversations as well. It gives you a different perspective into their safety, how the caregivers are coping, all of that fun stuff. So hospice is one. There's also skilled nursing facilities that I've seen different datas on the skilled nursing facilities. A lot of the ones that I've seen is you can get hired with a bachelor's or a master's degree. Typically, the roles are called social services directors, social services assistants, something like that. And the skilled nursing facility is typically going to involve a lot of case management, doing care plan meetings with families, talking with clients, advocacy, again, working with the interdisciplinary team. So that can be a really, really great foot in the door. And the skilled nursing facilities are everywhere. And it's a growing need. I will let you know that, none of these systems are perfect. And a lot of the skilled nursing facilities, it's going to be really challenging work, and it's not for the faint of heart. So do some more research around that. I've never worked at a skilled nursing facility, but I have worked within them. I've had clients within them. I've worked with the social services folks over there. There is end of life planning, talking about hospice. So skilled nursing facilities really do provide you a really broad depth of experience as well. There's also oncology. So that is specifically working with clients or patients who have cancer. So being able to work with the doctors, with the nurses, with the people, case management, coordinating transportation, getting them resources, making sure that they have the care that they need, access to medications, a lot of that stuff. Talked about palliative. So palliative is the step before hospice. Palliative keeps shifting and changing over the years. I did work there for a little while, doing a lot of therapy, consulting, assessments, safety assessments, because these are folks who have a serious chronic illness and that are not likely to get better. So sometimes there's people with cancer, sometimes they might have heart disease, a lot of times they have diabetes, a lot of times they have lung disease of some sort. Maybe they need to go on dialysis. So palliative is the place that people go for pain management. Like that's kind of a big part of their goals, is being able to keep people kind of well managed out of the hospital is a major goal. out of the hospital, managing their chronic illnesses, making sure that they're safe, that the caregiver is not burnt out, that they're not being abused or neglected. So a lot of really great experience too within palliative care. And you will be having the conversation around transitioning to hospice care within that industry as well. Another area is dialysis. So dialysis is typically found within clinics or medical outpatient facilities. And you're going to see the people anywhere from once to 4 times a week, maybe every day, depending on how much dialysis this person needs. But it's essentially people who have kidney failure. So you're going to be talking with them, doing a lot of resource management, case management, again, talking with doctors, being an advocate for the client. So that's another very great way to get started in medical social work. Another area that you may not have thought of is working in transplants or surgery. So there's always social workers who work within these departments to help people prepare and recover from surgery. So there's a lot that goes into mentally preparing people for surgery, helping them understand the breath, answering common questions that they might have, being the connector between what the doctor is saying and helping them understand and absorb what the doctor is saying, making sure that the family is well prepared for the care that someone might need after surgery, and also to the lifestyle changes that may accompany that surgery and helping them plan for that. So transplant is another area that people don't talk too much about. Another area is with health insurances. So a lot of health insurances have social workers who are going to reach out to their clients who might be high risk, who need some case management, who are in need of just additional resources to be safe. If they have a lot of hospitalizations, chances are there will be a social worker reaching out to them to see like, hey, we've noticed you've gone to the hospital a lot and this is costing us a lot of money. So what is going on? How can we keep you safe at home? And let's see, another area is home health. And this is, from what I've seen, it's typically short term. So it's people who have generally been discharged from the hospital and they are now at home and maybe they're too sick or too weak to get out and go back to the doctor's office. So sometimes they'll request home health care, which is really amazing for a lot of people. And sometimes, a lot of times, it might be short term in order to just kind of transition them, making sure that they're safe at home. They will call you as a social worker to come and evaluate, make sure that they're safe, evaluate for depression, making sure that they have the care that they need, food, access to resources. Because if they're not able to go to the doctor's office, chances are they're not able to go to the grocery store and carry back all these bags of food. So they're going to need these resources from you to help them acclimate and to make sure that they're safe and that they don't have to go back to the hospital. So we covered a lot. And just to recap, here's a list of areas that you can start out at outside of the hospital if you want to get involved in medical social work: hospice, skilled nursing facility, oncology, palliative, dialysis, transplants or surgery, health insurance, and home health. This is by no means all encompassing. These are just the main ones, the main areas of medical social work that can give you some ideas of where to look for jobs at, what kind of agencies are in your area that provide these services that may be able to hire you on as a starting. Sometimes you can even get internships and volunteer opportunities at these different locations. For example, I know for sure most hospices have friendly visitors that you can get connected with, and you can go and visit clients who are in the hospice service. And while you're not doing therapy or clinical interventions, you're still being a supportive presence. You're getting to know the medical team. You're getting to know the social workers, networking. So when a job does open up, you could be the first one that they think about because they have seen that you're reliable, that you know what you're getting yourself into, that you connect well with the team and with the patients. So it's a really great way to get your foot in the door. So hospices, friendly visitors, bereavement programs, sometimes they have opportunities for you to make calls to the families who have lost loved ones. I know that sometimes in the NICU, working with babies, sometimes they do have a need for people to come in and cuddle the babies, especially babies who are recovering or withdrawing from drugs or substances. A lot of times those babies need a lot of cuddles, and the nurses are not able to do that, to cuddle with them, because they have a lot of other babies to handle. So that could be an option for you to look into. Also, there may be an ombudsman program in your area, and these are trained volunteers who advocate for people in skilled nursing facilities, in healthcare facilities, and that can be a really, really great job to get experience, again, kind of from another perspective. And you could also visit your local senior center, your local skilled nursing facility, and see if there's an opportunity for you to lead any sort of ongoing activity with the residents that live there. They a lot of times have bingo games, they have game nights, they have entertainment nights. You could do friendly visitor. There's could be a lot of opportunities there at your local senior facilities or skilled nursing facilities. Um, and one last note, just kind of on the future of medical social work, I think it's going to be really, really interesting to see what happens, because these are all in-person settings. I didn't even talk about the telemedicine opportunities that are available, mostly because with telemedicine, from what I've seen so far, is you have to have a license. So a lot of times they're not entry level, that they want you to have all of these experiences so that you know the right questions to ask, so that you know what's going on. You can kind of like sniff out, like, is this patient being completely honest with me? What is really going on here? So I've seen a lot of different opportunities where virtually you could do assessments, you can do psychosocial assessments, you can do 5150 assessments, people who've come in for suicide. So there's a lot of really cool opportunities that are unfolding. So this is not an exhaustive list. There are so many different areas. And with telemedicine, it's going to be really, really interesting to see how this is going to come together with the social work interstate compact that is currently in process. So it's been enacted in 22 states across the US. And this is essentially saying that if you are licensed in one state that is part of this compact, then this license is valid across all the states in the compact. So, for example, if you get licensed in Arizona, that means that you can practice in states like Washington, Utah, Colorado, Kansas, Virginia, Pennsylvania, New Hampshire, Vermont. So again, the opportunities are going to be so vast with this compact coming up with your license. So if this is an area that you are interested in, definitely kind of keep your eye on that. If you want to be kept updated on different social work resources, I do have an email list that you can join. The link is there in the show notes. And that is it for today. If you know somebody who's interested in medical social work or going on a medical social work interview, this episode can be really, really helpful for them to kind of see what are the different aspects, what are some terminology that they might need to know, what are some duties that they can expect to be asked about in the interview. So I'd really appreciate it, and they would appreciate it if you shared this episode with them. Just open up your podcast app, click the little share button, and send a text to them right now. All right, my friend, that is it for this week. I'll see you next week. Thank you for listening to the Social Workers Rise podcast. I want to give one final shout out to one of our sponsors, Social Work Wealth Con 2024. Thank you so much for your support of this podcast. Check out this conference in October with the link in the show notes.